Here at Integrated Aesthetics, we have 2 accredited surgery centers. We're accredited by Quad A, which is a certifying body across the US, and that holds us at the highest standards of safety and protocols that we need to follow to remain accredited with Quad A. Behind the door is where the magic happens. So here at Integrated Aesthetics, we offer 3 different types of sedation. There's oral sedation, where we're giving you something like a Valium to help you relax. That means during the procedure, we're infiltrating a lot of numbing medication. We can take that sedation to the next level by using an IV and giving you medication so we can titrate up and down a little bit more easily during the procedure. Chances are with this, you're not going to remember much of the procedure, but you are breathing on your own. And you might actually converse with us, but may not remember too much of the conversation. The third option is also where you might just say, knock me out, just wake me up when it's done, and that's more general anesthesia. So those are the 3 options for breast augmentation. So the surgery itself, if we're just doing a straight augmentation, is probably an hour or less, but you may actually be in the operating suite for a little bit longer because it takes time to prepare you for the actual procedure. And it also helps you or takes time for waking up after the procedure as well. So plan to be with us for a few hours. That includes the preoperative visit, the actual procedure when in the operating room, and the recovery time. So on the day of your surgery, when you arrive, you're going to be coming back here, joining one of our nurses. They're going to review your vitals, get an IV placed if needed, help you change your clothes, and then I'm going to be joining, and we're going to go through some surgical markings and also review the surgical plan. And then once all that is completed, we're going to be escorting you back to the operating room where the magic happens. So how is a breast augmentation procedure actually performed? Well, let's take you back into the operating room. So once you arrive in the operating suite, you're going to be laying down. We're going to put all sorts of leads on you to make sure we can monitor your vitals during the procedure. If there is some sedation that's going to be onboarded, we'll start that process as well. And then after everything is set and we're ready to start, then we're going to be prepping the chest with sterile solution to help make sure that we have a sterile field. You're going to have sterile drapes placed on all over. We're going to be having sterile gowns and gloves that we use during the procedure. So once you're all sterile and draped, we're going to start using the surgical markings to start infiltrating the appropriate amount of numbing medication to make the procedure more comfortable. If we're using IV sedation or oral, then we're going to be infiltrating a much greater amount to make it more comfortable and tolerable. If we're doing general anesthesia, then we're going to just be focusing on where our incisions are to help minimize the post-procedure discomfort. We also use numbing blocks that we're going to be infiltrating long-lasting numbing medication before we get started. That also helps with your overall comfort during the procedure. Once we get started and we make the incisions to access the breast pocket, we're going to be creating a pocket underneath the surface of the breast, expand that area to allow a big enough pocket for the implant to go in. We use a funnel, a sterile funnel that we allow to use smaller incisions to add an implant during the procedure so that we can do it in a very clean and without much touching of the implant at all. Once the implants are in, that's where we close the incisions, and we're going to be using sutures. We use fine sutures for the very superficial layer to try to minimize scarring. But because we're using smaller sutures, you have to be extra careful in terms of following the instructions about your activity restrictions after surgery. Once everything is closed, that's where we're going to be putting on a surgical bra, and that's going to be something you're going to also use for the first 6 weeks. You don't want to use any kind of underwire bra during the recovery process. You can transition to maybe a snug sports bra as well, and you can always bring those in during one of your post-operative visits just to validate and make sure that it's safe to use during your recovery process. And then after you leave, you're going to recover, and we'll see you the very next day just to review how everything went. Thank you for joining me today, where I was able to answer many of your breast augmentation questions. If there are questions that you have that I was not able to cover, please leave them in the comments below so we can address them in future presentations. If you enjoyed this video, please give us a thumbs up by liking the video. Remember to subscribe and hit the bell icon so we can keep you up to date on future topics. Thank you so much for joining me today. I look forward to seeing you the next time.